Hello, everybody, and welcome to the latest episode of the Raving Patients podcast. As you know, I'm your host, Dr. Len Tao, and today we're going to be talking about promoting your safe practices to your patients in regards to infection control and OSHA. And I'm talking with one of the industry experts, someone I actually met at a conference called Jumpstart when she actually won one of the contests for being basically the best speaker. She gave an awesome presentation. So I'm really excited to have on my podcast today, Karen Daw. Karen is an award-winning national speaker, author of numerous articles and CE courses on safety in dentistry, and a trainer for practices in healthcare systems across the country. She earned her BA from the Ohio State University and her MBA with concentrations in healthcare administration and business management. After graduating, Karen was recruited from the emergency department to a role as Assistant Director of Sterilization, Monitoring, and Health and Safety Director for the OSU College of Dentistry. Karen is a proud member of the Organization for Safety, Asbestos, and Prevention, where she also served as a co-chair for their annual conference and infection control boot camp. So she obviously has a lot of experience in OSHA and infection control, and we're going to spend the next 35 to 45 minutes talking about this because it's such a big topic right now, especially because of the issues we're dealing with in the COVID era. So, Karen, thanks for joining me today. I'm excited to spend the next few minutes with you, talking about this very important topic in this day and age in dentistry.
Thank you so much for having me. It is a pleasure and an honor to be called an expert. I certainly don't think of myself as an expert. I just think of myself as a person who likes to talk and have a ton of information to share. So thank you so much for introducing me so kindly.
So to begin with, we met at Jumpstart. You gave that great little speech on infection control and your doings. So for those that don't know who you are or haven't heard about you before, why don't you kind of expand on your bio a little bit more and talk about it? And by the way, she's talking to me from Honolulu right now. So you want to get a little jealous. She's in Hawaii. Many of you may be listening in very cold areas right now while she's basking in the beautiful weather in Honolulu. So she's in Hawaii. I know you said you were from Hawaii, Ohio, and you went to Ohio State University. So why don't you expand on your bio a little bit, talk about how you got into dentistry, so the listeners know a little bit more about you. And then later, towards the end, we'll get into the would you rather questions I like to ask.
Yeah, absolutely. So I grew up, actually my father was in the service, he was in the Air Force. So we moved around quite a bit. I was actually born in Kansas City. And my father got stationed in Hawaii. It was a lot closer to Taiwan, which is where my mother is from. He met her when there were military bases, a lot of Air Force bases in Taiwan and around Taipei. And so when he got stationed in Hawaii, he had an opportunity to go back to Alaska or stay in Hawaii. And my mom said, you could go to Alaska, but you're going to go by yourself. So we're here. I was raised in Hawaii near Hickam Air Force Base, attended Ohio State University because, when you grow up on an island in the middle of the Pacific, you want to go to the largest university that you can find. At the time, it was a toss-up between OSU and Texas, and the other criteria that my parents gave me that if I was going to go abroad to study and they were going to help supplement my education was there could be no beaches, because I'm a big fan of beaches and I spent more time at the beach than I did in high school, I think. So that's how I ended up in the middle of Ohio where there were no beaches and a lot of cold weather and snow. So I was able to graduate. My parents were really happy about that. And then after graduating, I was immediately tapped because I knew I wanted to be in education and I wanted to be in healthcare. How could I marry the two of those? And, my nickname growing up from my mom was Little Boss Lady and Little Big Mouth. Those were like the two nicknames my mom gave me. So I thought I had to find a career field where I could marry all of these. And I got a job offer with Riverside Methodist Hospital. After about 2 years there, I was recruited to Ohio State. Wonderful woman, Dr. Joan Inucci Herring, took a risk on this 20-something-year-old to come in and help educate and help run the sterilization monitoring service. And from there, I became the clinic health and safety director. And all the while, educating our dental hygiene and the dental assisting students that would come through our clinics, all the while educating them on safe practices and then having them contact me once they graduated with questions or concerns like, hey, Karen, I'm an associate at this practice, and we're not really doing things the way you had told us we were supposed to do things. Or, I just bought a practice and the entire inherited the team that came with it, and they're all stuck in their ways. And how do I shift this culture? How do I get the buy-in from the team that I need so I don't have to babysit them in this area? And my consulting business was born of that. And then about 4 years ago, I just went full time with the consulting and the speaking and the training portion of the business. And I haven't looked back since because I love what I do.
Hey, and that's important. You got to love what you do. So talk to the listeners about, before we get into kind of the content. Talk to listeners about how you help practices. What do you do for them?
Yeah. Lately, it has been not only just getting them up to par with training, because there is, for those of you who don't know, and hopefully everybody knows this by now, but if you don't know, I'm here to share with you that we absolutely must underline, highlighted, exclamation point. We must do OSHA training. It doesn't matter what state you're in. Okay. There are some misconceptions about how often that training needs to occur. Must do OSHA training every single year, period. And not talking about January of 2020 and then doing it again December of 2021, because technically under OSHA, that's like 2 years. We have to be able to do OSHA training within 12 months of the last one, or as close as possible. And if you don't meet the anniversary date, or OSHA anniversary date, you got to be able to justify, you got to have a darn good reason why you didn't do it. And believe it or not, when practices were closed in early 2020, those practices, because of technology that's available to us like Zoom, they were not given a pass to meet that annual obligation. So I had practices scrambling and contacting me afterwards going, hey, Karen, oh my gosh, I just read your blog post, or I just read your social media post that said we have to do our OSHA training even if our office was closed. We didn't do it. What are our next steps now? And so I'm able to help them either in person, although nowadays it's, all online, but with live training to meet that annual obligation. And now we also have to make sure that we're training them not only in just the traditional bloodborne pathogens, because if you look at the bloodborne pathogens standard, it specifically says bloodborne pathogens and other potentially infectious materials. And that includes anything that's capable of being spread through respiratory droplets and saliva, of which COVID falls under that umbrella. So now we have to train them on COVID as well. In addition to training every single year, we have to train them upon hire, and you have to have that documentation. Documentation is key in all of these. How you choose to train is entirely up to you. I would love it if everybody that's listening today would contact me and say, Karen, we want you to help train our team. We want to make sure our I's are dotted and our T's are crossed. But certainly I'm not everybody's cup of tea. I'm very energetic. People like sometimes, the Bueller method of OSHA training. And so that's how I distinguished myself from that. Some people like that, and that's fine. I'm not going to talk down about that. My brand of presenting was built upon the number of OSHA courses that I had sat through myself, and was like, this is what I would do differently, because the key thing is not that we just only, not only that we present and train and coach our teams, but that we get the buy-in. How are we going to give them this information in a way that sticks, so that a year from now, they're still going, remember that story that Karen told us about the reason why we don't pass a needle uncapped across the patient's face, or why we must wear utility gloves when we're cleaning instruments and turning over the room? How are we going to make sure that the team is able to recall the information we're giving them? And then as a practice owner, that's less for you to have to worry about. It's no longer as much of a liability or risk to the business. So I kind of partner the two, the safety along with the business aspects of it, kind of look at the pain points. Why aren't we doing training? Is it really that we just didn't know? Why? And then if we are doing training, how did we choose the method that we chose? I mean, I have gone into practices, I'm not kidding you, I have gone into practices where they are still doing training off of a VHS tape. Some of your listeners don't even know what that is. I've actually seen a beta tape, right? With OSHA training. So that tells me a little bit about what the culture is like in that practice prior to me helping them. So my job is not to shame anybody. My job is to look at your practice and go, okay, if we need to be here with safety. And when we're over here, what do I need to do then to help get you to fill that gap, to fill that void?
Gotcha. No, that's really
And
good.
yeah,
I wasn't clear or wasn't sure exactly how you accomplish it. And obviously, I think Zoom has made your life much easier because you can do things virtually now, and you don't have to go into offices. So, obviously with COVID and the way things are, it's made your life a little bit easier. So, I want to
It
talk
it
about.
has. It's given me more of a reach too. I just wanted to say that real quick. It's given me more of a reach. So people think that because I'm based in Ohio, that's all I do. I prior to COVID, I had practices that would fly me out to the office to do it. Now we can do it via Zoom. So wherever you are, and even if it's not with me, reach out to somebody that you can trust that's going to help you with your safety program.
And I have one
Definitely.
question actually regarding because I'm sure this is a common. You said you need to do it yearly. So and obviously January of 2021 and December of 2022 is not the timeline. So is it a year to the date every year you need to get re-educated?
It is. The way I word it is you got to have an anniversary. You have an OSHA anniversary date. That will help you to kind of remember it. So I tell people, mark your OSHA anniversary date in your calendar, just like you would any other anniversary or major milestone that happens like your birthday every single year. And make that part of your office's safety operating procedure so that if it was, Terry was responsible for it previously, and then Terry wins the lottery. Maybe she won the Powerball and quit the office the next day. You have it in writing that the next person, if Chrissy or Susie were to come along, or Mike, can pull up the SOP for training in the office and go, okay, not only do we train on HIPAA, we train on infection control, we train on OSHA upon hire, but also looks like our anniversary date is January 28th or March 17th or November 10th, whatever the case may be. Then okay, I have got to get something scheduled on the calendar for the next year.
And then what does the annual requirement? What is the annual requirement? It's a federal requirement, correct?
It is a federal requirement. So regardless if you're under a state, there's about half the states are under a state-run OSHA plan, and the rest of us are like in Hawaii, where I am right now. We have a state-run plan, and it's monitored and enforced by High OSHA or High OSH. And then in Ohio, we're under the federal umbrella of OSHA. So we're in a federal OSHA. But regardless of where I am or where your listeners are, that is the mandatory requirement that we do that training on an annual basis. And everybody who has the potential of being occupationally exposed has to be part of this. Now, here's something that I encourage. I want our administrative team members part of this conversation too, because many times they are the ones who are able to spot those infection control or safety breaches that have become second nature, has been a bad habit that's been picked up by some of our clinical team members. And when we're talking about a culture of safety, everybody has to hear the same information. So yes, every single year and upon hire, if there's a new standard, you guys are going to hear it from me first, but if I were a betting person, I'm willing to bet we're going to see some sort of respiratory protection standard that's going to be universal. We already have a respiratory protection plan in place that's under OSHA, but I think some sort of new standard around this pandemic, or maybe an enhancement of the existing standard around respiratory protection
And then what
as a
is the
result of the
requirement
pandemic.
annually?
The annual, as far as the OSHA training goes,
Yeah.
yeah. So OSHA training is that you have to receive training. Everybody in the office that's occupationally exposed has to receive training by a qualified instructor. We have to document that training, and also include COVID as part of that discussion. There also is the mandatory requirement, and a lot of offices, you guys don't know this because they're not typically being covered during training. So I'm here to tell you, I cover this in my training. Please, please, please do your hazard assessment and PPE certification. Hazard assessment and PPE certification, that is mandatory. And then once you've determined what are the hazards that exist in your workplace, and you have documented, so my spreadsheet might look like, okay, here are all of the activities that take place in my office. Okay. We do, ultrasonic scaling. I'm using a drill. Then the next column might be, okay, what are the engineering and work practice controls that I have implemented to mitigate the risk associated with these processes and procedures? Then the last column is, okay, here's the PPE that's required. Now, when you look at that and you look at the CDC criteria for when to wear N95s, pretty much I'm going to say almost all of your listeners are in an area where there is moderate to substantial transmission of the virus as of the date of this recording. And therefore, for generating aerosols in one of these areas, that N95 is your gold standard for masks. So I know that their offices are like, oh, well, I heard that we can use a level 3. Well, there's certain criteria around being able to use a level 3 and a full-length face shield. But even then, the teams that I'm coaching, I'm telling them an N95 is going to be the highest level of protection for your team. And with that N95 comes the need to have a written respiratory protection program and a medical clearance by someone other than the employer. That medical clearance, appointing somebody to oversee the program, training everybody on the contents of the program, and then finally, the employer can do this part, but fit testing everybody when it comes to the use of that respirator, whether that's an N95 or I'm seeing a lot of offices use a half face elastomeric respirator. It might be a little bit more costly initially, but in the long run, it's going to save the practice some money, and you can disinfect and reuse those, unlike the N95s. Something else I wanted to tell your listeners too, and I'm sorry to turn this. I just go into remote mode and I start talking about OSHA stuff. But something else really too that I think it's very important for your listeners to know, and then we'll talk about how this is going to benefit the practice from the business perspective, is that N95s can be reused if we're under, crisis or contingency capacity. With the ramping up of the availability of the N95s, which as the time of this recording is January 29th, gloves are the ones we're kind of having issues with, not so much as everything else, but gloves now are the big thing, which I never thought in a million years that would be the concern. But N95s, as we ramp up production, as are more available, well, then you have to go back to treating that as for its original intent, which was as a single-use disposable item, just like you would with your gloves that you use with your patients. So we have to get that ingrained. I think people are so accustomed to saying, I'm going to use the N95 over and over again, and I'm going to do that even after the pandemic. No, it is a temporary measure that has been implemented based on the fact that we can't get enough of them. Once we get up to standard supply, you have got to go back to treating it like a single-use disposable item.
Gotcha. No, that makes perfect sense. And I was going to ask you that question anyway about the N95, but you got it right then and there. Yesterday, I think I told you I interviewed Sherry Lipensky and Fred Joyle about their Clara mask. So I don't know if you've heard of that mask before, but if you haven't, and if you're listening to this podcast and you haven't heard that episode, you may want to look into that mask. I actually use that. I think it's an awesome mask, especially when I fly. So I don't know. Have you seen that mask before?
I have. So that I'm going to reach out to them. As a matter of fact, as a result of our conversation earlier today, it reminded me I wanted to reach out to them to see if I could get a sample then I can speak to it. I haven't got my hands on one yet. I've been wearing an N95 if I ever have to do
their mask is awesome. It's very comfortable, and it obviously does what it's supposed to be doing. So we wanted to talk about promoting your safe practices to your patients and obviously your employees as well, which is really important. So obviously getting trained to do things properly is one of the ways that we want to do this. And that's why you have to kind of do a yearly recertification, I guess you call it, really yearly training. But what are some other ways that you can accomplish promoting your safe practices to your patients and team?
Yes. So let's talk about the safety dialogue with our employees, and then we'll talk about the safety dialogue for our patients. With our employees, one of the things that I noticed when practices were closed and then when they reopened again was reading the dental boards versus the dental hygiene versus the dental assisting boards and the threads that were coming about. And everybody had valid points. Every single person, I don't want to invalidate anybody's thought with reopening. But there were some areas where hygienists and dental assistants and doctors and business owners were not really seeing eye to eye. And I felt like, oh gosh, it sounds like we just need to have one big mediation process to get everybody to kind of communicate around what our concerns, our pain points, our fears around going back to work. And one office in Ohio that I work with, the doctors had a very open and honest discussion with their teams. They brought everybody together, and there were tears and there were laughter. And as a result, only one person didn't come back to the office. So here was an office that was able to retain everybody in a world where I heard about practice as almost being a revolving door where people were coming and going. And I think it was because we didn't stop to think about some of us anyways didn't stop to think. We thought, oh, our team loves us, they're going to come back, they're going to trust us, but we didn't think about what was the messaging, the overall messaging. How are we going to show them that we do care about their safety when they come back to work? I think training is one component of that, making sure that they get that training. And if they want to take additional infection control training, support that. Don't just say, oh, well, we did our annual training, why do you want more CEs and infection control? I tell offices that work with me all the time, you don't want to just hear from me every single year. I'm blessed to be able to be invited every single year back to many of my practices, but I also tell them, if you have an opportunity to take another infection control CE course, do it, because the more people you learn from, the better, the more tools you'll have in your toolbox when it comes to safety. So having that conversation, that open dialogue, and letting your employees know, I have an open door. I have an open door. Anytime you have a question or concern, I'm not going to say I'm going to implement everything just because you came to me about it, but I will promise you that I will listen to you, and together we will arrive at the best solution for this practice. And then that's going to reassure our team that, yes, it's safe to come back. I do care about you. I do want you to go home safely to your family. And I do want you in turn to be able to have this safety dialogue with our patients. And some of the ways that a practice can do this, even before the patient steps foot in your office, is to think about what type of messaging you're promoting on social media. Can we harness the power of social media to reassure our patients that they have chosen not only a practice that provides quality care, but we do it in a safe environment where we care about our patients, where we care about our employees' safety, especially in the era of COVID, where all patients are hearing about is this virus, highly contagious, and it's spread via aerosols. And then you think about going back to dental office where they're using hand pieces and they're generating aerosols. How are we going to reassure them that we're taking every precaution? I say, let's show them all the other things we were doing before the pandemic. Let's show them all the stuff that we were doing beforehand to protect them. Let's do a Facebook Live or even a pre-recorded video that shows you walking those instruments from the moment the patient leaves, what happens to those instruments through the cleaning process, through the sterilization process. Do a hyper loop of this video to show them about that. They may not have really thought about it. You can ask a hygienist. I guarantee you, in an audience of hygienists, many of them will raise their hands when I ask them, how many times has the patient asked you, do you throw away your instruments between appointments? It's because the patients kind of get it, but they kind of don't at the same time. Majority of the hygienists will raise their hands and say, yeah, I have patients that ask me that all the time. So what can we do to reassure them about instrument reprocessing or even environmental disinfection? What did you do in this chair and in this space since the last patient was in here? Let's push aside that curtain and show them what is it that we do. And then when it comes to COVID, let's share with them, via their confirmation text messages, the importance of us asking you screening questions. It's not to be an inconvenience or a burden to you to ask you via text or phone call confirmation, and then again when you arrive at the practice, but it's also to ensure your safety. And we want to let you know that we ask everybody else the same questions for your safety and for their safety. What if they visited your website? Do we have a pop-up that says, hey, if you want to learn more about what we're doing to ensure your safety right now in the era of COVID, click this button, and it'll take them to a landing page that talks about all this stuff, how your practice meets or even exceeds CDC and OSHA standards. But if you're going to talk the talk, make sure you're walking the walk too. Don't just say it to say it, because I think patients nowadays can smell BS from a mile away. Let's be authentic in the conversations we're having. If we're not doing annual training and now we know we need to do it, let's do it. And then let's tell folks, hey guys, you know what? We always strive to do better. So every time we learn something new, we're taking advantage of that information. The other thing is, what about assigning an infection control coordinator or an OSHA officer, and whatever you want to call this person, director of safety for the practice? Let's give them a title. And let's make that person the go-to person, that if a patient has questions, if the front desk, the front desk should have a basic spiel around some frequently asked questions. And then if it involves a more deeper explanation, let's say, you know what? Holly's our infection control expert here at the practice, our infection control coordinator. And I know she'd love to hear from you because these are great questions. How about I just get Holly on the phone and she can answer your questions? It'll just be a couple minutes. She's finishing up with a patient. Or why don't I get your name and number and have Holly call you back, and then follow through. If you're going to call a patient back about safety. I've got a story about how my mom was looking for a new dentist before the pandemic. And I said, Mom, what are the 5 criteria you're looking for in a new dentist? 4 out of the 5 had to do with safety. I don't even think my mom knows what I do, honestly, for a living. But she asked questions like, oh, do they open the instruments ahead of time, or do they open it in front of me? Which that one blew my mind. I didn't even think my mom was looking at stuff like that. But that was one of the questions she wanted me to ask. And so I was calling around all these practice. I called a dozen of them. And every time I asked them, I said, hey, I'm calling on behalf of my mom. We're looking for a new dentist. And she has some general safety questions. I started asking questions like, how often do you test your sterilizer? And I had one office go, oh, we test it monthly. And I said, well, do you know in your state that you're required, and the CDC says that you're supposed to be testing that weekly? And so you hear this muffled, she covers up the phone, you hear this muffled, and she goes, oh yeah, we do that every single week.
Yeah, right.
So
yeah, sure.
these are the, yeah, right. Sure you do. And then there was an office that said, oh, you know what? I don't know the answers to these, but I'll call you back. And they never called me back. And I called them 3 or 4 times. And finally, by the 4th time, I said, this was just an office that wasn't uncomfortable. How unfortunate. They were not comfortable with having this conversation with the patient. And I think that if COVID did anything, it really put a spotlight on safety. And now is the time for us to be figuring out, what do we want that message to be with our patients?
Yeah, it's interesting. You just hit the nail on the head there, where patients are so conscious about safety now. I predicted during COVID that a lot of the reviews being written were basically how the practices were dealing with COVID. Were they taking temperatures? Were they did they empty out their waiting room? Like, I don't have a waiting area anymore. Patients wait outside and then they come on in. I was just reading today a post on Facebook, and someone said, are we able to go back to having waiting rooms right now? And someone made a comment, well, I'm the only person at my front desk, so there's no way that I can do it without having people wait in my waiting room. I'm like, what do you mean? Just have them wait out in the car, and you bring them in when you're ready for them. That shouldn't change how you handle that. So it's really interesting how people are just dealing with things a little oddly in my mind. I'll never have a waiting room again. I think it's perfect to have them wait in the car until they're ready for them. I think that's the way it should be, and it just changed the way we do business now. And I think everybody's going to accept that. In the same note, unfortunately, I think everybody's now using COVID as an excuse when it's not really COVID. Oh, I have a sniffle. They really have allergies, and they think they have COVID because they don't feel that great. I mean, everybody blames COVID now, and I think it's problematic in the way we're doing things, because what are you going to say? No, you're not sick. Everybody's blaming COVID right now, and that's a cause for concern, whether it comes to patients or employees.
Mm-hmm. And I think we could do a better, 2 things you said real quick that I wanted to touch on. I think we could do a better job of educating patients about what is and what COVID is and what COVID isn't. What are symptoms of the common cold? What are symptoms of seasonal influenza? What are symptoms of COVID? Because like you said, a lot of people can look at the stuff and go, oh, I might have, I think I have COVID. I think we live in a world with a 24-hour news cycle where we become overly sensitive to stuff like this, and not to fault anybody, just we're a product of our environment. And I think that definitely hasn't helped. And yes, the way, COVID has changed the way we do things. And for an office where we have a team member that feels that she's the only one at the front desk, so she can't do anything unless there's a room full of people, a waiting room that's full of people. Well, that tells me a couple things about the dynamics in that practice. Either she doesn't feel comfortable bringing this up to her doctor and saying, hey doc, I'm not comfortable with this, we have to find a better way, and then together let's figure out a solution to this. Or she wasn't knowledgeable that, really there are better ways to do this. Sometimes you can go into an office and I can tell you within a matter of minutes if I'm going to have more of a resistant culture or if I'm going to have that one embraces the messaging. And as a matter of fact, I think I've been working on, and I've almost successfully gotten there, where I only want to work with my ideal fit clients, those who need my help and are open and receptive to the fact that they might need to change some things in the practice. If there's an office that just wants to hire me for check off the box training, we just want to get training done and we heard you're really good at it and we don't want to do anything else other than just do the training, then I'm kind of a little bit concerned. Not that they have to work with me from a consulting standpoint, but if they tell me right off the bat, all we want to do is just fulfill this requirement and that's all we're having you come in for, then I'm like, you know what, maybe there's someone else that might be a better fit for you. Or here's a VHS tape that you can watch that'll do the same thing.
Yeah, no, 100% so. So, I know we talked a little bit about the training required for OSHA and infection control in the practice, and we did it kind of a little out of order there because I started asking questions. Is there anything else you wanted to add in particular to that topic?
Yes, not so much the training, but how to get the practice in really good shape. There's some really good resources out there. And it does require reading. I ask an office like, so tell me a little bit about the disinfectant that you're reading. And then they'll give me some basics and then I'll ask them some more deep questions that they really need to know. I mean, you're introducing a new chemical. When we were playing disinfectant roulette, there were certain requirements about SDSs and training the team on the SDS and then reading the label to determine, is it a one-step product? Is it a two-step product? Is it a cleaning and a disinfectant? How long's the contact time? What's its active ingredient? What surfaces and other chemicals is it incompatible with? So I start asking these questions they can't answer. And I'm like, so have you read the label or the SDS for this product? And they're like, no, I read the front of I read the front of the label. I didn't read the back of the label. So I get it. It's not the most attractive reading material, but we have to do it. And it's the same thing with the guidance documents that's provided us by the CDC and OSHA. It's free. Let's take advantage of it. It's everything we need is out there. We just have to read through it. So one of the resources I share with folks is OSHA has a COVID specific page that you can go to, and it will lead you to all of the links that you should, how to create and give you a template for a written respiratory protection program and how to create your own exposure control plan. So all that information is out there. The CDC, every time, they don't call you and go, hey, Len, I thought you'd like to know. We've had an update again, right? Nobody's calling you. So having an infection control coordinator check the CDC COVID website for dentistry on a routine basis is going to be a good idea too, because they've housed all that information on one page. I will caution you, you can easily it'll easily lead you down a rabbit hole if you start clicking on just random links on that page, because there's so many. But just start with the first one. Start with the first page. Don't try to get everything all in one day in one big bite, right? Take little nibbles at it. Read it over a lunch break. If you have 15 minutes, read 15 minutes worth of that information. And then the next day, read another 15 minutes. And eventually you'll get it. It'll start to make sense. The other resource I want to share with you is OSAP, OSAP.org. They are a dental safety specific organization. I've had the privilege of co-chairing their annual conference and their boot camp, which they just concluded earlier this week. They have opened up their members only pages to non-members to help the dental community navigate through this pandemic. And also later on this year, they are going to be offering the first and only nationally recognized dental safety certification, which means you're going to be able to earn some additional letters after your name. Take a look at their website for more information, but that's a good resource. And then the last one is, I just hope your listeners will want to follow me on social media. I always post content-rich information on Instagram, on LinkedIn, and on Facebook, and I actually even have a private Dental OSHA and Infection Control Facebook page that you can go on there and post a question if you can't find information elsewhere. You can also lend your expertise. If somebody says, hey, we have a shortage of gloves. What are you all doing about shortage of gloves? And then you'll have 30 people from all over the country respond to your question. And conversely, I hope that you will also hop on there from time to time and help another colleague out by answering one of their questions too. So it's a community built around this free flow of credible information. Credible is key. Don't get your information from social media. There are a lot of myths on social media surrounding the COVID vaccine. And I want, right now we have to, as healthcare professionals, we have an obligation not only to get vaccinated ourselves, but also to educate each other on the importance of reaching and attaining that herd immunity. If it's we get vaccinated to protect those who can't, not those who won't. Right. And I always want to make that clear distinction.
Is your feeling that every employee in the dental practice should be vaccinated?
I'd like for us to educate every employee on the importance of getting that vaccine. Yes. I would, in a perfect world, we'd all be vaccinated. I have enough time getting, trouble getting people getting their annual flu shot because I think the government wants to implant a chip in you, or, the COVID vaccine leads to infertility, or that there hasn't been enough studies done. They push this through too quickly. And I will tell you, I initially, and a lot of people kind of felt the same way, right? We were feeling that, oh gosh, certainly, something that was pushed through that without the standard 2 years or 1 year or 2 year study is not going to be that safe. So we all felt that initially. But what we found out was that the vaccine is actually very safe. The government is not trying to implant a chip in all of us or affect our infertility. They would not have approved it had it not been safe. And as a matter of fact, I am eligible to get the vaccine now, and I'm going to be getting my first shot in 2 weeks. And if you've already received your vaccine as a healthcare provider, and I think your listeners are part of this group, thank you so much for doing that, for protecting yourself, for protecting your family, for protecting others, and also for being the cheerleaders that we need right now to educate our patients on the importance of getting that vaccine when their time comes too. So thank you all so much. And the key thing is become a critical thinker. Don't take my word for it. Don't take social media's word for it. Don't take your best friend's word for it. Do some reading. You're going to come to the conclusion that's best for you, and don't let myths or misconception drive your decision. We are all in healthcare. We are healthcare professionals capable of arriving to that conclusion.
And I agree with everything you said there. So before I do my wrap and actually ask you to provide some contact information for you, I want to use, and we talked about this beforehand, and I know the listeners like this part of the podcast, something different. I have these pod decks, and we're going to do the Would You Rather deck. And I'm going to pick 10 questions. It's kind of lightning round, so give a response and you give a brief explanation. As I always say, I won't do anything inappropriate. We don't want to go off on tangents for things that we don't want to talk about here. So, all right, question number one. I just shuffled the deck, and question number one is, would you rather pull a tooth with a pair of pliers or brand yourself with a cattle prod?
Oh my God. Would I want with someone else's tooth or my own tooth?
Your own tooth.
Oh, that is a tough one. Or brand myself with a cattle prod. Okay, I'm gonna say pull my own tooth because that I can possibly, I could get another tooth to replace it. Wait, I'm assuming I'm gonna do it with anesthesia, so I'll say that. But a cattle prod, that seems more permanent, so I'm gonna say pull my own tooth.
Okay. Hey, there's no right or wrong answer, obviously. Would you rather?
That one's a tough one.
Yeah, this is not easy. This is tough too. I want to hear your answer to this one. Would you rather spend the night in a dumpster or a porta potty?
Oh, these are both tough ones. Okay, I'm going to say dumpster, because even when I worked in the emergency department, I mean, you get used to it over time, but just the smell of that porta potty, that, the bathroom smell, it just makes me go, whereas I think a dumpster, I think I could, over time, I'd get kind of used to rotten garbage, I think. So I'm going to say dumpster.
I refuse to use a porta potty. So I think they're the grossest thing. I think they're the grossest thing in existence. And I think if your job is to clean them, that's disgusting. All right, next question.
They need to be paid more.
Yeah, exactly. Would you rather have your face printed on money or your own small town named in your honor?
My face printed on money or a small town named in my honor. I'm going to say face printed on money, because if I'm still doing what I do, that is the ultimate branding, ultimate marketing for me, free marketing. Unless I was the mayor of that town, that would make things different. But I'm going to say money, face on money.
Okay, so this is an interesting one. I don't think it's inappropriate, so I'll ask it, but it's kind of a weird question. Would you rather watch a porno movie of your parents or with your parents?
I'm going to say with a gun to my head with my parents. Because there are just some things you can't unsee.
Unsee, yeah, no. Definitely not of my parents. Definitely not. Okay. All right. Let's see. Would you rather abolish war or find a cure for every type of cancer?
Oh, gosh. Certainly no one else has had such difficult questions to choose before. Abolish war or cure every single type of cancer. I'm going to say abolish every war. And the reason why is because, and this is coming from somebody who has, my baby sister's a 3rd-year breast cancer survivor, is because I think we have a better chance of finding a cure for cancer, or we've taken great strides in that, whereas war is it's perpetual, right? We would hope for an end to that. So I think I'll go for the underdog, and I'm going to say I would abolish all war.
Okay. Would you rather take cold showers for the rest of your life or never get more than 4 hours of sleep ever again?
I actually do both on a regular basis. So neither one of those are too inconvenient for me. I do cold showers because ever since high school, I heard that it makes your hair really shiny. So I always end my showers with cold water, and everybody compliments my hair sheen. I don't know if that's the reason why or not, but but I do believe in the importance of your body needing that sleep time to rejuvenate. So I'm going to say I'm going to go with I'd rather sleep longer than 4 hours than I'd rather take the cold showers.
Okay, perfect. Would you rather be handcuffed to the most annoying person you know for 24 hours or go camping with someone who likes you but you don't like them back?
Handcuffed to somebody who's annoying for 24 hours that I absolutely can't stand, or go camping with somebody who likes me but that I don't really do. I'm going to say 24 hours because we didn't put a time limit. Did we say 24 hours camping, or just said camping in general?
No, just go camping.
I never camped for just 24 hours. Okay, I never camped for just 24 hours. So I'm going to say I'll be handcuffed to somebody who's annoying for 24 hours because I'm going to bring earplugs with me.
Hey, there's nothing wrong with that. All right, this is the funny one. So, and because we're speakers, so would you rather fart in an elevator full of strangers, or belch loudly while giving an important presentation?
Oh, totally fart in an elevator with strangers. I mean, you said loud. Is it loudly or is it a silent one?
No, silent fart.
Silent fart, totally. Totally, because I'll just start staring at the person next to me.
Yeah, you'll blame someone else, of course. Yeah, 100% so. Yeah. Okay, two more. Would you rather eat a bag of marshmallows, a whole bag of marshmallows, or a whole jar of peanut butter at once?
Eat a whole bag of marshmallows or a whole jar of peanut butter at once?
Yes.
I'm going to say I'll eat a whole jar of peanut butter at once, because I used to hate it unless it came with jelly, like on sandwich, and now I kind of really like it. So I would do that.
Okay.
And because
And last
marshmallows
question.
tend to, unless it's the, oh, go ahead.
No, go ahead. Finish up.
Oh, I was gonna say, because I don't do gelatin, I'm a vegetarian, so I don't do gelatin. So unless it's the vegetarian marshmallows, then I'll go for the marshmallows. But those are hard to find.
Okay. And the last one, which I always ask because I think it's a cool one. Would you rather never be able to use a search engine again or never use your smartphone apps again?
Never use. I'll give up my smartphone apps. I so much of what I do, and just because I am an inquisitive person, I'm constantly Googling stuff, even if it's outside of work. I think in a past life, I was either an investigative journalist or a researcher because I ask a million and one questions. I would say I'd give up my smartphone apps.
Okay. Hey, those are great. You win
Those
the
are really
award.
good.
You win the award for best explanation and answers. So I appreciate you enjoying that and spending
Yay! I
5 minutes or
told you
so
I
doing
like to
that. Yeah,
talk.
yeah, that was great. That was great. So Karen, thank you so much for spending 45 minutes or so with me, teaching us about OSHA infection control, how important it is, the fact that we have to do it every single year, all the stuff about COVID as well. So Karen, why don't you let the listeners know how they can reach out to you?
That I would love it. I would love it if you guys want to partner with me in safety. And I always consider it an honor to be able to work with your practice. So if you'd like to schedule either training or training and consultation or just a consultation, we can even do a mock inspection or review your OSHA manuals and your SOPs. You can reach out to me via my contact form at www.karendaw, Karen, Karen, Daw, DAW.com, or the OSHA lady .com. Either one will take you to the contact form. You can also follow me on social media and message me that way as well. And Meg, my assistant, will make sure that we get some time to connect. But regardless, even if you don't, thank you so much for your time today. Time is something that we don't get back, and I know how valuable it is. So thank you so much for taking the time to listen to our message today about safety. And thank you, Len, for the opportunity.
Well, I appreciate it. This was very enjoyable. And guys, if you don't get OSHA every year, you're ready to get recertified, reach out to Karen. She just gave you the contact information. She's a blast. Her presentations are hilarious. So I know that. I was reading some of the reviews on her website as I was talking to her. So, she puts a nice little spin on things. That's a very boring topic normally. So definitely reach out to Karen. If you like this episode, please share it. Subscribe to us on iTunes. Review us on iTunes. Remember, I have a Facebook group called Raving Patients. If you want to join it, please do. This wasn't based on reviews, but as I always like to say as we end these podcasts, remember, your reputation matters. Until the next episode, thanks again, Karen, and we'll talk to you guys soon.